Why are prescription drugs so expensive? I will tell you, Medicare was prohibited by law from negotiating lower drug prices. And those costs then got passed on to our seniors, but not anymore.
So right there you have Kamala Harris talking about one of the signature sort of achievements in the area of public health and medicine for the Biden administration, which is allowing Medicare to negotiate prescription drug costs. And they're now rolling out some numbers for what the prices will be for certain medications that they're saying will save literally billions of dollars for consumers. Now, we've been critical in the past of how limited this policy is. There are not a lot of drugs that are on that list, and we will talk more about that. But the criticisms aren't just coming from those that think that the action in this area should be bolder. There are those on the right that think literally nothing should be done to control the price of these medications. And so we're gonna turn to House Speaker Mike Johnson. Him and other GOP leadership put out a joint statement attacking the drug price negotiation policy. They described the plan as price fixing. So again, anything that's done to get prices down is price fixing. So you can't negotiate. Which is weird because I feel like Donald Trump has made that kind of like historically a big part of his brand is negotiating and all that. Apparently it's all price fixing. Okay, their prescription drug price fixing scheme has accomplished just two things: driving up healthcare costs and crushing American innovation in medicine. And there are a lot of truly insane Orwellian things that the right says about politics, but that might take the cake because the idea that it is allowing Medicare to negotiate on drug prices, that is what is driving up the cost of medicine. When we pay 10 or more times as much as the other countries that do this sort of negotiation, like that's what's causing it, is utter madness. And again, as with so many of these other areas, I don't think that this is going to convince people. I think people know that something needs to be done. They want Medicare to be able to negotiate. Our medicine as well as the medical procedures is just so out of step with every other advanced Western nation. And so it's good to see Harris at least talking about going farther. And we'll get into some of the actual numbers, but Jordan, what do you make of all this?
I think it's great. And this is something that will actually move voters. There was polling conducted recently, and you see the top most persuasive messages are all about the cost of healthcare, having access to healthcare, expanding Medicare, and addressing corporate profits and the cost of living. That is what voters overwhelmingly care about right now. And they can point to something and say, hey, Trump said he was going to do this, didn't do it, of course. We did. And here you go. I mean, the numbers, like I see people in the chat even talking about their own prescriptions and the copays going down. I mean, there's significant cuts in the cost of these. It's not that the supplies cost that much. I mean, we're talking about medication. The research in many cases was funded by public dollars, and they're profiteering off of the backs of you all. And you see people around the world look at the American healthcare system and think, why are you paying so much for this? This is ridiculous. They know it's absurd. I mean, you're talking about cuts in some cases 60, 70, 80% for prescription drugs. This was totally doable at any point, and the Trump administration just chose not to do it.
Yeah, look, the idea, and they don't want to put it as simply as it is. The right doesn't want to. The idea that no, Medicare, which we're going to say that these sorts of plans, any government involvement in healthcare is inherently inefficient and all that. They should not be able to negotiate at all. They should literally just take whatever the corporation says they should. Who thinks that should be the way that it works? No regular person thinks that. No conservative person thinks that. Only people who are being paid by the industry think that they should be able to set whatever price they want. And to say that negotiation is price fixing when their policy is the pharmaceutical companies should be allowed to fix whatever price they want is truly madness. And I love it, by the way, coming out of, what are we, like 4 years into the right sort of centering their ideology on these companies are getting away with murder. You can't trust them. They just want money. That's what the vaccine, it's all BS. They're just trying to get your money. Oh, by the way, when they sell you medicine, they should be able to get as much money as they possibly want. Like how, it is a psychotic ideology that they have over on the right. And just briefly before we end, there's only the 10 drugs that they can negotiate on that obviously needs to be expanded. But the new prices that will take effect in 2026, the discounts now will range from 38% to 79%. Like, If you had gone with Trump back in 2020, it's likely that you wouldn't have this. That is going to affect tens of millions of Americans and is going to make their life just a little bit easier. This is how the government actually doing something, which is all too rare, can really improve people's lives. They're saying something like $6 billion in savings to taxpayers. So that's a start. We could go much deeper, I think, and broader on this, but it's certainly a start. Members make a difference here at TYT. You help make the show happen, and we see you in the chat with your loyalty badge. Click the join button to become a member today.